My name is Crystal Brigman, and I'm from Springfield, Missouri, and I'm here with Planned Parenthood affiliates in Missouri. And I'm here today to tell the Speaker of the House and our Missouri government that I do not want to honor Rush Limbaugh. I do not want to honor an individual who says I am an irresponsible slut because I have insurance that covers contraception so I can plan my family.
Hi, I'm Joyce, and I'm here with Planned Parenthood, and we're very much against this Bill 749 because we feel that all women should have a right to choose their birth control and not have any employer determine what birth control you get or not. And we really are for women's health. Thank you.
48th District in St. Louis, Missouri. So I want to bring up what I consider is the future. You know, there are people that have to come behind us because we have term limits, and this young lady I think is going to be an awesome public servant. And so I'm asking her to run for office, and she doesn't even know it yet. I'd like to introduce you to Sarah Felt, a third-year Mizzou law student and president of Law Students for Reproductive Justice.
Thank you. I'm Sarah. I'm happy to be here today. As a third-year student at Mizzou School of Law and the leader of Mizzou Law Students for Reproductive Justice, I have a lot in common with Sandra Fluke. And we all know Sandra Fluke was a Georgetown law student who was turned away from testifying at Darrell Isa's all-male congressional panel on birth control coverage. Sandra's voice was eventually heard, and what happened after that's part of why we're here today. I'm not going to repeat the denigrating things that Rush Limbaugh said about Sandra, but I will tell you that I know exactly why he said them. To make people like me and you sit down, shut up, and put some aspirin between our knees. In Sandra's words, because we spoke so loudly, opponents of reproductive health care access demonized and smeared me and others on the public airwaves. These smears are obvious attempts to distract from meaningful policy discussions and to silence women's voices regarding their own health care. These attempts to silence women and the men who support them have clearly failed. I know this because I've received so many messages of support from across the country, from women and men speaking out because they agree that contraception needs to be treated as the basic healthcare